We see a lot of patients that come in with flat feet ailments. Their feet are completely collapsed. They're having pain, whether they're pediatrics or even adults. And there's two types of flat feet, flexible and rigid. Flexible, you can move it up and down. Rigid, they're just stuck as a rock and can't dorsiflex it or plantar flex it, which just go up and down. There's conservative treatments, which is custom orthotics, custom insert, that we actually take a real mold of your foot, send it to a lab, and we have a custom molded insert that goes in your shoes. Nobody knows they're in there. Unfortunately, there are a lot of patients that are so severe that they complain of hurt, they're in a lot of pain when they walk. They can't stand in one place for a long time. They go to the mall, I can't do it, I have to sit down after 10 minutes. Then we entertain surgery. It is day surgery. It's a 2 to 3 procedure conjunction that we do. We lengthen the Achilles tendon. I put an implant in the subtalar joint to actually limit the motion of that flexible flat foot. And we actually reroute one of the tendons to bring up that arch. So flat foot is a very, very big common diagnosis that comes into our office. A lot of times they're just misdiagnosed, or they diagnose well, and doctors will say, just go get some Dr. Scholl's, or just go get some over-the-counter inserts. You gotta make sure, see what kind of flat foot do they have? How is their heel positioned? How is their front of their foot positioned? Do a full biomechanical exam. Very, very important, because if it's not treated right from the beginning, they're gonna have a lot of problems later on in the future. That's why it's very important for a lot of kids to make sure you're getting the flat foot treated right, and don't have parents not ignore that. Because if they do, when they're 20s, 30s, and 40s, that's when problems start arising. So it's better off to, as a pediatrics, meaning from they're a child up to 18, that's considered pediatrics. We get them into a custom molded orthotics. The perfect age in the pediatrics is 14 to 16 to do a flat foot surgery. And it's very common, there's nothing wrong about it, but if they're in that much pain and that much discomfort, especially the athletes, get it fixed.